Today I'm going to show you how to ace clinical management. This is a domain that GP registrars don't tend to score very well for a variety of reasons. Want to learn how you can score well in clinical management? This is a video you don't want to miss because I will give you a step-by-step guide to achieve a clear pass in clinical management. Hi everyone, this is Dr. Erwin Kwun. I'm on a mission to help doctors lead a happier and fulfilling life. GP registrars often struggle in the second half of the consultation due to fear of committing to a working diagnosis, insufficient time for clinical management, or not taking into account the person's specific needs and preferences, thereby making a generic management plan. Clinical management is daunting for many, but it doesn't have to be. You know why? Clinical management is an exciting part of the consultation because it is a part when you can make a real difference to your patient's life. After listening to the patient's problem and understanding where they are coming from, you can apply your clinical knowledge to offer practical solutions to help the person in front of you or on the line. Giving yourself sufficient time is key to do well in clinical management. Otherwise, you end up rushing, you may skip important steps. Let's unpack the 8 steps involved in clinical management. First thing first is that at minute 6, you need to be switching from data gathering to clinical management. If you're not making the switch at around minute 6, then you're not giving yourself enough time to manage your patient. So the first step is to formulate and verbalize a working diagnosis. This is important because if you don't formulate a working diagnosis and you don't verbalize it, then the patient doesn't know what you're treating, the examiner has no clue. When you verbalize your working diagnosis, the patient understands what is going on because you're conveying your thought process to the patient, and the examiner has an idea of what you're diagnosing. Step 2 is to integrate idea, concern, and expectation in the second half of the consultation. By integrating the idea, concern, and expectation, you're readdressing the patient's worry, you're readdressing the patient's concern, and you're managing the patient's expectation. If you don't do this, then the patient will leave the consultation with unmet needs. The patient may still worry or may have some question that they didn't have opportunity to ask you. So that's why it's very important to readdress idea, concern, and expectation. If you don't readdress idea, concern, and expectation, then why did you ask for it in the first place? Step number 3 is to reach shared understanding with your patient. You want to be on the same page with your patient. So that's why readdressing the idea, concern, and expectation is important, because when you do that, then you actually are going to get shared understanding with your patient. If you don't do that, then you might be thinking something and the patient might be thinking something completely different. That's why we ask about ideas, concern, expectation to get an idea what's going on in our patient's mind. And then in the second half, we share what's going on in our mind, our thought process, and then we try to get a shared understanding with the patient. A pivotal phrase that I would suggest you use to complete step number 1, 2, and 3 is the following. I know that you think you may have gallstone, but I think that it's a kidney stone because the pain is in your loin. What do you know about kidney stone? By using this pivotal phrase, what you're doing is that you're formulating and verbalizing a working diagnosis. You're integrating the patient's idea that they may have a gallstone, and you're addressing that by sharing your thought process that you think this is a kidney stone, and you're also justifying that this is a kidney stone because the pain is in the loin. The next step is you're also establishing the patient's pre-existing knowledge. So this simple phrase achieves 3 different things in the consultation. By doing that, you're making sure that you have a shared understanding with your patient, establishing the patient's knowledge about kidney stone. Then you can pitch the explanation of the kidney stone to the level of knowledge that the patient already has. Once you have reached shared understanding with your patient, then the next step is to discuss about what can be done about this problem. So you can categorize it into what the patient can do, lifestyle modifications, what can the doctor offer, discuss about the treatment options, discuss about referral to specialists. This is where the discussion becomes more interesting. We discuss about what can be done to solve the patient's problem. The order in which you discuss the treatment options is key, because it's very important that if you know that this is the first line what you would recommend, then it's best to discuss that in the first instance, and then you may discuss alternative according to the patient's preferences. Let me give you a working example. A woman in her 30s presents with heavy menstrual bleeding. She's desperate to have something to help this problem, and you discuss the treatment with the patient. So if you go through the discussion, in what order would you discuss the treatment options? As you may know, the Mirena coil is a first-line treatment for heavy menstrual bleeding. So it's important to discuss the first-line recommendation in that order. Then you may discuss about medical management with tranexamic acid or contraception. Last week I was coaching a GP registrar. When he was discussing his management, he also discussed about surgical management. Now, there are times when surgical management might be useful to discuss, but if a patient is presenting with heavy menstrual bleeding and you haven't even tried the first line or the second line, then it might not be a good use of your time to discuss about surgical option if the patient hasn't brought this up. So that's why it's very important to think about the order of treatment and referral option. A common pitfall to avoid is to think that patient-centered care is about sharing options. Sharing options is just one of the elements of patient-centered care. What you need to be doing is you need to discuss the pros and cons of each treatment that you offer to the patient so that the patient can make an informed choice. So for example, if you're discussing the Mirena coil, then it's important that you discuss the pros and cons of the Mirena coil. Then you may go and explain about the other option, medication. This is very helpful to enable the patient to make their own decision. Sometimes you might find that the patient is lost and doesn't know which option to choose. This is where it's very important that you discuss the pros and cons and make a professional recommendation to your patient so that the patient can make a decision. So your job is to support the patient to make a decision. If the patient does not choose the first line recommendation or what you think is the most effective, then it's important to offer an alternative that's going to suit the patient's preference and need. Another option is to watch and wait if there's no action that needs to be taken at present. Step number 7 is to provide safety netting advice. It's very important that we emphasize on the fact that you need to provide appropriate safety net advice. The college has reported that some GP registrars are providing safety netting advice that are generic, so call 111 or call 999 if things worsen. Let me give you a working example. You have assessed a patient over the phone who is known to suffer with migraine for the last 10 years and is complaining of worsening migraine. And the patient currently does not have any headache. You've decided to offer the patient an appointment to come down in the afternoon. And before you complete the consultation, you provide safety netting advice to the patient to attend A&E if the symptom gets worse. By providing this advice to the patient, you may cause anxiety to your patient, and it's not very clear when the patient needs to attend A&E. What other reasons are you asking this patient to attend A&E if the symptom gets worse, if you're going to see the patient in the afternoon? So this is where it's very important to give safety netting advice that's appropriate and that makes sense. By offering to see the patient in the afternoon, you're already taking a safety net measure. So asking the patient to attend A&E if the symptom gets worse on top of that is something that is not necessary. And if it was not an examination, chances are you probably would not do that. So make sure that when you're giving safety netting advice, you are not causing excessive anxiety to your patient. You're not giving a safety net advice not natural to your practice. Safety netting advice needs to be specific. You need to explain to the patient what are the symptoms to look out for. What are the signs that if they do have XYZ to reconsult immediately. This is specific, succinct, and the patient understands what are the things that they need to look out for. Last but not least, step number 8, agree on a follow-up plan if necessary. Making sure that you have continuity is important, especially if you're managing something complex or if you're managing a problem that you think you need to see the patient again. So offering a follow-up plan and arranging this follow-up plan with your patient is very important. It's very important that you make sure that your follow-up plan is clear, so the patient understands how the consultation is going to be arranged, whether they have to arrange it or whether you are going to book it for them in 2 weeks' time. If you're offering a follow-up plan, make sure you're specific. Don't just say, I will see you in the next 2 to 3 weeks. Would you like to see this patient in 2 weeks or 3 weeks? Make it clear. If you've enjoyed this video, then I've got another video where I'm sure you're going to learn a lot from. This is a video where I discuss how you can compress data gathering so that you give yourself more time in clinical management. Click the video here to watch it. Take care everybody. Bye bye.